I've been in practice since 1995 and began practicing hair restoration surgery in 1996. My practice currently is predominantly hair restoration surgery and medical treatment of hair loss in men and women. I also do cosmetic facial procedures, phlebology, and dermatologic surgery. In my experience, LCPro is the most effective medical therapy for hair loss that doesn't involve medications. I was very skeptical initially because it sounded too good to be true. It sounded too simple to work, and in my experience, there's now no question that it works. I've been using low-level laser therapy in my practice for the last 10 years, and now with LCPro, more and more of my patients are able to use this technology because they can do it at home. They don't have to come to the office for treatment. Low-level laser therapy works very well, and it's an effective treatment for the progression of hair loss in men and women. It definitely decreases inflammation in the scalp, and we see that after hair transplantation. Patients who do low-level laser therapy after they have a hair transplant heal faster, have quicker resolution of redness compared to patients that don't. It helps hair to recover, so hair that's thinning or being lost, it helps that hair to recover and become fuller and healthier again. It's an effective treatment for male and female pattern hair loss, and I'm also beginning to use it in my patients who have inflammatory types of hair loss because of the anti-inflammatory benefits of low-level laser. Laser therapy with LCPro has been particularly useful in my female patients with hair loss and in my young male patients who have hair loss. LCPro has given me another tool to treat their hair loss and have their hair be as good as it can possibly be. Before the availability and development of LCPro, I had 2 large clinical low-level laser units in my office, and patients would come in to the clinic for treatment. This was effective and it worked, but it was cumbersome and time-consuming for patients and for my staff. And all that changed when LCPro became available, and I no longer use my large clinical lasers because, in my view, I don't need them anymore. Treatment compliance with the handheld hairbrush style lasers is poor, in my experience, because of the low power output of these devices. It takes hours and hours to achieve the same amount of laser energy exposure to the scalp as one session with the LCPro. So LCPro is quick and it's easy because patients can do it at home. It's portable. I have patients that do it while they're cooking, working on their computer, exercising, whatever, any other activity. It can't get easier than this. You put the cap on, you turn the laser on, 36 minutes later you turn it off. It plugs into the wall, it comes with a battery pack, you can do it while you're doing other activities. The FDA clearance of LCPro in women is another level of confidence for my patients in the effectiveness and the safety of LCPro. In my practice experience, LCPro is the best way for my patients to get the most effective low-level laser therapy for their hair loss, period.